Welcome, everybody. Thank you so much for joining us for another one of ElevatePFS's podcast series with market leaders. We are excited today to bring to you two people from the same organization, but with very different perspectives due to their job and their roles. So today with us, we have both Kathy O'Hara and Lisa Vincent from Tucson Medical Center, which I will probably be referring to as TMC for the purposes of our conversation, because that's how I know you guys. So thank you so much, Lisa and Kathy. Thank you for joining us. I'm going to ask you guys to both introduce yourselves. At what length, that's up to you. But please share, of course, with us, what your title is, what your role is, and the organization. Anything you want to mention about that as well. Okay, so Kathy, you get to join, kick us off.
Thank you very much. So I'm Kathy O'Hara. I am senior manager at Tucson Medical Center. I'm primarily on the hospital side of the business. I've been in healthcare for 40 plus years. So I started as a baby. I have been in primarily just the revenue cycle, the hospital billing and follow-up, most recently denials. I also oversee the charge master, revenue audit, and contract reimbursement team. I've done everything from I've been involved in managing admitting and then going through to the business office side of things. So that's primarily what my background is.
Awesome. Thank you. Lisa, you are up.
Thank you. I'm Lisa Vincent. I'm the Senior Manager of Revenue Cycle for the outpatient division of TMC. And we have 25 sites, 250-ish providers. We do the professional billing in the hospital and then also for all of our outpatient specialties and primary care and pediatrics offices. Like Kathy, I started in healthcare a long time ago. Started off as I was a dialysis patient care tech for several years. I started off as an office manager in a small physical therapy office. So I've done the roles myself as I worked up to supervising other people. And in my role, I support the outpatient coders, the insurance verification, billing and follow-up, cash posting, all those roles.
Excellent. Yeah, we've kind of been talking about this particular podcast internally, just the two sides of the coin here in terms of your guys' experience from the HP to MP side. So we're excited to hear kind of how that to some of our questions and just your guys' thoughts and some of the topics that we're going to bring up are going to align, but also kind of vary at the same time, just given the different roles. So Lisa, I'm going to come right back to you since you kind of got to do it. So a good friend and a colleague of mine, of course, Scott Willig, he loved asking this question. So we'd like to start off with this one. So Lisa, if you would get a little bit more into how you got into healthcare and healthcare and rev cycle. I understand you starting in dialysis.
I had no healthcare experience, and I answered an ad for a dialysis patient care tech. So and literally it was high school diploma and 6 weeks of training. And then you're on the floor putting those giant needles in people, hooking them up to dialysis machines. We had 13 patients to one nurse, and we each had like 4 patients ourselves. And yeah, so it was quite a lot of responsibility with not very much background. That was scary.
Hey. Had to do what you had to do, right? Take care of those patients. That's amazing. And have you stayed in healthcare ever since that time? Did you ever kind of do it?
No, after that, my husband and I had a business doing tile. I got out of healthcare altogether. And then I had a really good friend who said, I found a job for you. And it was a job as an office manager in a small physical therapy practice. And I was, I can't have a desk job. I'm not a desk job person, but she said, no, I know you. You just give it a try. And she was so right. Ever since, I've been billing, coding, office managing type things ever since then.
Love it. That's awesome. Kathy, how did you get into this crazy world that nobody actually knows exists?
So similar to Lisa, I moved here from California in 1984 and 85. And I was just looking in the ads to see what was available. And since my family has healthcare background, I knew I wouldn't probably qualify for anything in the business office. So I started off in what they call the light bite at St. Joseph's Hospital here in Tucson. And then a job opened in the business office, and it was cash posting. So I started off doing some cash posting. I did some financial counseling. Then I was a Medicare biller, and I was one of the first billers that we entered claims into direct data entry. So we manually, otherwise before that, it was all paper.
Paper, yes. Yes. Now, what's Light Bite?
Light Bite was just a small snack shop that they had inside of St. Joseph's Hospital. So I worked in there and just made sandwiches, made all sorts of just snacks for all of the employees mostly. But I saw an opening and no background. And I worked my way through. I did go to school for a while and I tried to get some education. And then I had some great mentors along the way that really helped me to move along. I mean, I think that was key, is I was always in the right place at the right time to move me along and had a lot of great help along the way.
Good. Well, that's awesome. And I'm glad you mentioned that. We're going to come back to that kind of idea of mentors that have been a part of your growth here a little later. But thank you both. It is such a I love to hear this. Everybody we talk to, just such a weird, unique way of kind of getting into it. I definitely had no healthcare revenue cycle experience. I came more from the tech world. And so when someone talked about coding, I was like, is that Python? Is that C#? What kind of websites are you? I'm surprised I got my job. But anyways, let's get into some of the more specific questions here. And again, whoever wants to jump in first, that's great. But again, love to hear both sides so that we can kind of get a feel for that duality and also what's common that you guys are facing. So top of mind, biggest challenge right now in the revenue cycle space for you as it pertains to your role and kind of what you have domain.
So for me, I think navigating all of the payers and all of the payer guidelines. So you would think that each payer would have the same sorts of policies, guidelines, and they don't. So I think it's the biggest challenge that we have. And then just getting paid for our services, it's quite a challenge to make sure that we have all of the supporting documentation to make sure that we're getting everything paid and that we can reduce denials and not have to resubmit claims. So I think the challenge is, just navigating all of the payer requirements.
Well, then how quickly it'll payer
change. They change rapidly. In that sense, I can tell you that back in the olden days, that getting a claim paid, you didn't have a lot of regulation back in the 80s and early 90s. So we got paid for the services that we provided. We didn't have to go through all of this regulatory guidelines and this payer wants this revenue code and this payer wants another, or this modifier, that modifier. So it's a challenge.
Lisa, I would say on my side of the house, it's the same. It's different, but it's the same. It's the payers. It's navigating their challenges. Kathy mentioned not having a lot of regulation when she first started, which I think was a little bit before I started. And when I started, we were starting to see different wants from different payers, different payer policies, but they were still very consistent. Like, this is the rule, you follow the rule. If you don't follow the rule, they'll deny. But I feel like we're seeing some probably AI-based denials where you can't reality test, where every time I send it this way, it always pays. Now it's just all over the place. You don't know what you're getting. So it's even more complex than it used to be.
Yeah. And I'd say that our last guest that I interviewed also mentioned the AI being used as a tool to quickly find a reason to deny. And now we're combating. We're going to have to start pitting robots against robots, right? Like, that's what that's going to come down to, because a human being can't compete against an AI. And so we have to understand, how that works. But this is sounding all too familiar, unfortunately. So when we think about these challenges, what might be a goal that you guys have for the next year? What's maybe, it could be overarching, or you could say, in this one particular area, I'm looking to do X, Y, Z, but just something that's kind of top of mind for you over the next year, what you would like to try and get accomplished or get a hold of.
So for the hospital side, I would say, and Lisa's probably has the same thoughts and ideas, but just taking advantage of all of the new technology that's out there and trying to reduce the denials by staying on top of some of the things that the new technology can help you with.
Yeah, agreed. My focus is going to be, denials, following up on denials. That seems to be the hardest thing because of all the change that happens so quickly. So we're looking at, additional staff training. We did just get an enterprise membership to HFMA. So we're going to have lots of people getting new certifications and everybody's very excited. And so our people ask for training all the time. I think what they want is the kind of training where it would be like, United Healthcare is going to do this if you try to build this kind of claim, that sort of thing, which I don't even think exists. But any training at all is just helpful to have people solve that mystery every time something denies to try to get the claim through. And also AI tools.
Yeah. And Lisa, I think you probably see the same thing. those denials sometimes are so vague. And then half the time you're calling, you're not getting any response on a website. If you do a call, sometimes you're on hold forever, but you're just trying to get to the root cause. Sometimes they're not clear. I can tell you we have what are called playbooks. However, it just seems as if we build the playbook and we're constantly adding and taking out. And I think that that's something that we want to continue to make sure that we have current playbooks to show the staff so they can reference what does this denial need, or what does this payer need, or templates for the denial, for writing appeals and such, just having all of that data available to the staff.
I think it's more difficult to get good help on the other end of the phone too. Once you do pick up the phone, you wait forever on hold, and sometimes you get somebody who's just reading you the guidelines.
Exactly.
And they're reading you the denial reason back to you, and they don't really understand what's behind it, and neither do you, and nobody's getting anywhere.
Well, it's good to hear that there's an appetite for the education from your team, right? I think that's important for as leaders to get your teams in a mindset of knowing that this type of education will help them personally in their career, but it's going to help you guys' overall organizational goals hopefully get achieved. And it sounds like TMC is saying, yeah, let's provide this training. Let's get you hooked into HMA. Let's get that going. You feel like you have the backing of the organization to move forward with these types of engagements around education?
TMC is super supportive for education. Even before the HFMA enterprise membership, we have tuition reimbursement. I got my master's degree since I started at TMC. I've had help getting certifications. I'm a certified auditor. They helped with that. Yeah, TMC is very committed to education. And I've seen that HFMA is too. And I'm pleased about both.
Good. That's awesome. Yes, see you guys all around HMA and on LinkedIn is always a lot of I really feel that TMC is, as an organization and as a kind of an ethos, are committed to the people that work for them, to help grow them, to help nurture them, and to move them along, because obviously that's beneficial for you as a person and as in your personal life. And we all feel good when we accomplish things, and we kind of rising in the fields that we find ourselves in. But this is not a new concept, but it's a win-win, as it will help TMC be a better organization for your patients and your surrounding community. This isn't rocket science, because I don't have any clue what that is, but this makes sense, right? This is a win-win scenario. And when you got the right team and you're leading them in a way that keeps them hungry and open to these types of things, like, hey, we're going to help you do your job better, not you're doing it wrong, you need to do this, but like, hey, here we are now, let's get better, right? I love that. I love to see it because it's very powerful. So let's talk more about leadership and about the teams as you guys find yourselves in these types of positions. So you're responsible for people, right? You're responsible for that growth, and you're responsible for their output at the end of the day. What do you guys try and do to really set your teams up for success? And maybe outside of this education piece that we're kind of talking about, but what other areas do you really focus on to kind of drive that success within the team?
So for me, I think, over the years, it's not that complicated. It's really listening to them, keeping them informed, making sure that their ideas are valued, and just really connecting and making sure that they get all of the tools that they need to do their jobs well.
Agree. Just spending that time with everyone, having the one-on-ones, listening, being available. I have an unusual answer to this question as well. Measuring productivity, which always sounds terrible and people hate to have their productivity measured, but our teams they're fantastic. They meet their goals, and we were measuring the productivity even before COVID. So when everybody went home, we were able to say, it's the same. You don't have to worry. You don't have to stand there and watch someone work. These are dedicated people. They are doing their job, and we can show it with the data.
Well, and I would say, obviously in the sales role that I am in, I am very, I have one thing that I measured by pretty much, but in all cases, whether you're sales or not, like, notification, seeing progress made, getting the gold star for the Rise reading minutes for reading at home 15 minutes a day, while you're in grade school. Like, we all have inside of us kind of that interior desire to see our progress and see that. And then when you know that there's a measurement being done and that you personally can impact how well that measurement looks, there's something in there, and there's a positive way to do that, right? Because people not only want to be recognized for their hard work, but they want to be acknowledged for it. They want to be seen. They want to be, said, hey, we see you're doing this. This is great. Let's keep it going. That kind of thing. It is still a win-win scenario.
And having that data makes them feel comfortable too. They don't have to worry. Like, am I doing enough? Am I meeting the expectations? They don't have to, just make sure they're friendly with you so that they feel safe. They can say, I have the data that I'm doing the job you want me to do, and I'm confident and comfortable.
Yeah. Well, and then how do you combat burnout? Right? Like, I think you made a good point. Like, yes, you are doing enough. Yes, things are overwhelming right now for sure. And we're going to talk more about that too. But how do you combat the burnout, especially on these teams where it's hard to find talent in this particular section of the healthcare finance area that we're in? Do you want to keep the ones you got, right? It's hard to hire these days. So how do you kind of address that?
I think on my teams, the biggest thing that we can do is be flexible. We have lots of people working from home. We have some hybrid, some fully remote, and we try to be very flexible with schedules as long as it doesn't impact the work. We like people to be able to work at the time of the day when they feel most comfortable working. We try to be, give as much flexibility around their life as possible so they can fit their work in.
And making sure that they take the time they need off away from work. I am terrible at that. I used to get into work at 5 a.m. and, work until 4:30. And I finally said, you know what? I'm getting too old to be doing this. I'm tired. And so I decide, okay, I'm going to come in an hour later. I know it doesn't sound like it's a lot, but it made a big difference. And I expect my staff to do the same is take time for yourself and make sure you're not just working. I have most of mine are hourly, so they don't work overtime, but still you have time off, PTO, take it, make sure that you take care of yourselves and that, this is a job. Your family's what's most important. And that was something that was ingrained years ago just by a previous mentor that I had, that this is just a job, but your family and your life is most important.
I was really proud to hear you were coming in an hour later because for myself, for burnout, it's good. And for me, like that time early in the morning, like that's when I walk my dog with my friend, and that for me, that's that. And if I don't do it first, I will not do it. Like the whole rest of the day just gets away from you, and then so you have to just carve it out.
Right now, 5:30 to 6:30 window at best before it gets too warm. They take them out. I know. So keeping in this vein here of working with the teams and keeping things cool and copacetic and cohesive, and the fact that it is difficult to hire a certain talent for certain positions. How do you kind of, what's your take on developing talent versus hiring from outside, right? The person that was in a position where a boss came in from outside as opposed to elevating one of us team members, it was a difficult thing to swallow at times. But then I also recognized the talent and skill and experience that person had. And once we kind of got going, but for me, for all of us, it's a difficult pill to swallow sometimes. It's great to hire within and grow people, but at the same time, you don't necessarily always have every vegetable you need on the farm. You know what I mean?
Yeah. And you said it just exactly correctly, Brandon. It's hiring the right person that has the skills you need. So for example, and it's been very difficult. I think we found one person that had this experience. We recently at Tucson Medical Center took on the oncology business. So we have had, year over year, I want to say about a 30% increase in volumes. And this just added a lot of patients. That skill set is very different. We have never done oncology billing before. So, and in fact, we're still learning, and we just started sending out claims. So I'm a little concerned about what types of denials I'm going to see, and what types of differences there are in what is needed for those claims. So I think it's just making sure, getting back to your question, that you're hiring the right person for the job. And yes, we love to promote from within, but sometimes that skill set from the outside is needed for a particular position.
Yeah, I think that I always prefer to hire from within if I can. But there are difficulties with that too, especially if you're taking someone from a team and then like making them the lead of that team. There's always some growing pains. People are uncomfortable taking direction from somebody that used to be their peer. That can be hard. Bring in someone from the outside and people just, they're kind of adversarial at first because they're not really wanting to take direction from that person either. So It's human nature, I think. And for me, it's personality is almost as much as the skills. I can teach somebody skills, but you can't teach them how to be a nice person.
Yeah, no, that makes sense. When we talk about leadership styles, is there a certain philosophy that you kind of follow? And even down to, we can be more specific, a particular resource or a particular person, or a style of person that you had in your past to help you kind of understand what it takes to be a successful leader and to lead from within the team as opposed to, out in front kind of idea.
So for me, I had a mentor and leader early on who was actually with me for many, many years and brought me on to TMC. And I try to emulate her style. She's very compassionate. She helped you to grow. She got me involved in HFMA very early on, encouraged me to attend various seminars, webinars, educational opportunities, and just genuinely how to lead people with compassion.
Yeah, I've had several mentors along the way in different positions. And it's interesting, the philosophy, kind of the leadership philosophy overall at TMC, TMC's whole vision is about exceptional healthcare with compassion. And I really feel like that compassionate part, that empathy is the best way to lead people. I used to describe it as I was a cheerleader. Like that was my leadership style, like the you can do it. I know you can do it. And, elevating others under you to be able to lead teams, that kind of thing. And in my schooling, I learned, to be like a servant leader. That's kind of the model I like to follow. But there are role models for that all over at TMC. And I have in my career worked places where I was told that my leadership style was wrong because I was too nice. And I had to be to the people that I was leading. And it was so nice to get into my master's and I wanted to take pages of the book and mail it to the boss. Not right. You actually get more productivity out of people if you are nice to them. So stop telling people that.
I personally, a gentleman that I follow even to this day, his name is Simon Sinek. You'll see him on LinkedIn, small clips, but his take on leadership is very much that compassion, that empathy. I think both of those are very strong and important words. And yeah, it's so strange because when you think about these types of concepts, these are no-brainers. Again, we have not invented a new wheel here. This is how we all want to be interacted with, right? But for some reason, there's a hard line to toe at times, right? When that metric comes back on productivity, it is low, then there's time that the leader has to really step in and do some of the hard stuff, right? But that is 5%, right? Outside of that, this is a encouragement position, right? It's a like you said, being their cheerleader, showing them compassion, and then also leading by example, right? And having that good energy and sharing that with them and encouraging them through the tough times. And then, of course, it's celebrating the wins, right? Again, these are all, but I don't know what happens sometimes where some companies, like you said, think that, you gotta beat them with the stick, you know what I mean? And just no, it doesn't make sense. We as people, we don't respond well to that. So why would we bring that into a professional business setting? I'm going to pivot a little bit here. I would love to hear from you guys. As we enter a new era of healthcare and financial side of healthcare, this is going to change a lot of things. And obviously federal regulations are changing now and these types of things. My question to you guys is what does the phrase, the term patient advocacy mean to you, right? If I were to pose this to the layman on the street here in a healthcare setting, they're going to just talk about the care that a patient receives. And they're right. That's absolutely a huge part of it. But we deal in not necessarily the care, but the funding of that care, right? And the financial side, a topic that is just as sensitive to someone as their health is their finances, right? And so when we think about patient advocacy, what does that mean to you? Kathy or Lisa, who wants to take?
So for me, it's interesting because I feel like for this conversation also, you're having to kind of translate something that's coming from the clinical side and how does that apply to revenue cycle? For patient advocacy on the revenue cycle, we want to make sure that we maximize the benefit the patient has. We don't want to provide care to them that's going to incur them a big bill without knowing, so we want to be really transparent, but we also want to predict the future of what their payer is going to do when we send that claim. We want to help them navigate the the regulatory landscape, which is difficult enough for us. I always say, if it's difficult for us to understand, how are the patients going to understand it? We do this for a living.
Yeah.
So we have to find a way to explain it to them in language that makes sense.
Yeah. So one of the things we're doing here at TMC, because it's not only the care side, but when you're the patient and you get all of these different bills from the physician, from the hospital, from the anesthesiologist, from this, that, it makes it very difficult. So what we're doing, at least at the Tucson Medical Center, is we are embarking upon a single business office where the patient will get one statement for whether they were seen at one of the clinics or the hospital. And that will help them to be able to just pay online one place or set up their payment arrangements for under one spot. So we're embarking upon that soon. So I think that's exciting for the patient.
Again, the layman I don't think understands how big of an impact that is and how big of a part of patient advocacy that really is, because we are taking care of them. We're making it easy, understandable, consumable, because we are a transactional society. Like, I go to get a donut, I pay for the donut, I get the donut, I give them $1, everybody goes their separate ways. Like, we are good here because I understand what I'm paying for, what I'm receiving. So when you can bring that level of simplicity as much as you possibly can to this setting, then you will be more successful and patients will feel, less like, what's going on here? And we will pay for the services that are rendered to us. Like, that is not a new concept. But yeah, we get in our own way and we jumble these things up so much.
We actually talk a lot about patient experience as we brought the oncology on, because in our outpatient space, we have not had patients of this acuity before. And with the bills, in the hundreds of thousands of dollars range, we talked over and over again about, what will it look to somebody as they transition to us from the organization before? Will the bill look different? Will it be more expensive? How will we navigate that?
That's a good point. That's a whole new layer to the onion there. So we talked about it a little bit at the beginning, just in terms of your challenges that you guys are coming up against. And again, I think we are knowing that the payers are gearing up their AI. Is the organization also kind of dipping their toe into that realm and trying to equip your teams and workflows with AI?
Definitely. So some of the things that we're already doing, we tested out using AI for an appeal. So we had a clinical appeal submitted, and that seemed to be successful. We also implemented what's called Janus, which is used for a prior authorization. And then next year, we'll be embarking on using Janus for claim status. Another tool, it will be DAX. DAX records the physicians, their charting. And so they'll be using that at TMC as well.
So yeah, we started DAX on the outpatient side, and it's been really successful. It just listens, it edits out anything that isn't really related to the care for the patient, and then it puts it in like SOAP note. It categorizes everything, and the note is lovely. And from a coder's point of view, it's easy to read, and the important stuff is there. The extra stuff is gone. It's been working really well.
That's so cool. And I guess, from a patient advocacy standpoint, your physicians and just people that are interacting with the patient can spend less time in this and more time just connecting with them, person to person, human to human, and talking with it and listening to them, that kind of thing. Would you say it's kind of
definitely?
Yes.
We also just implemented an AI coder assistant in Epic on the outpatient side. So the AI is actually looking in the medical record, suggesting a code, and then it will highlight the little section of the note where it thinks that it supports that code. So we're still obviously looking at it. The coders are still looking at it. But the thing we find it helps us with the most is we don't have to go dig through the chart. Like, it's already found the pertinent note and the pertinent spot. So you click and it opens the whole thing, but it still leaves the parts highlighted that it thinks are important, which are typically pretty good. So it's a time saver.
Curation is key. Well, that's good. Again, like I said, back to our previous point, things that help the hospital be more efficient and to drive revenue and just be in an optimal workflow also benefit the patient. Like, it also can benefit the patient and provide them even better care experience. These are the way that these tools should be used, I think, right? Like, all right, so this is a no-brainer, of course, and it's a huge, gigantic 18,000-pound elephant in the room everywhere we go now. But obviously federal regulatory changes are happening. Given Elevate PFS and part of what we offer, we are very close and sensitive to this as it is impacting kind of the Medicaid population. So when you think about the big bill, anything top of mind for you guys that you're really kind of keeping an eye on or thinking about or trying to account for as you
I think the Medicaid funding, you hit that on the nail, is really, we have to keep an eye on that. That's really going to change the landscape of, like, if our patients are covered or if they're self-pay, if we have to come up with other programs. But that's really a challenge right now, is keeping on top of what's going on with the Medicaid funding.
Kind of an adjacent topic to this, on the outpatient side, I've really been keeping an eye on the vaccine committee, the preventative care task force. There's been a lot of shakeup there, and we've actually seen the American Academy of Pediatrics is now breaking with the CDC a little bit and the vaccines they're recommending. So I think eventually we're going to have a situation where insurances aren't covering the vaccines that our providers are recommending to our patients. And that's going to be very difficult to navigate financially. Those vaccines are quite expensive, and I'm just not sure how that's even going to work.
Yeah, no, that's a huge call out for sure. Yeah, no, I mean, obviously from the funds themselves being diminished to retro time on, applying a Medicaid enrollment to the event that brought them to, then the re-enrollments, the work requirements, these are all things that are heavily impactful. And, to my previous point and question about kind of patient advocacy, we as an organization, again, are close to this. And one of the things that we're doing is trying to be able to be in a position where we can account for whichever scenario a patient might need to go down. They present as underinsured, but now, given the landscape, there's going to be a lot of different scenarios that they can go down. Not everybody is going to be able to get on Medicaid. And so what do we do next, right? And also keep the patient in a level of confidence that we do know what to do next, right? Someone's not sitting there going, oh man, really just a if this, then that, if this, then that, and having that logical workflow down pat so that, again, the patient doesn't lose confidence, still believes that what is being told to them is true, so that they stick with you. And they still end up resolving their account, whatever that looks like. But these are all very difficult things, right? There's a lot more plates to be spinning at the same time now, and whatever other colloquialism I can think of. But that definitely is kind of coming up for sure. Are there anything more at a state level that you guys are top of mind? Obviously, that federal one is overarching, but Arizona Medicaid, I want to say Access seems to be a pretty good partner, right? And we had experienced this, and they show up to HMED. That's one big one. They're willing to walk into the room with us, right? State level, I feel like, they're going to do their part to communicate what's going on and still try and work with us. But we'll see. Well, we're kind of coming to an end here, guys. We've got through a lot of great content, and I really, really appreciate your guys' time, your insights, what aligns and what's a little different given your guys' roles. But I will open it up to say, is there anything else that you might want to say, good nugget that you've got, or anything that you would want that strikes you interesting about the role that you're in, or what's recently developed? Anything, any closing words perhaps, or anything else you'd like to?
Well, I think for me, it's being flexible, and nothing stays the same. We know that in healthcare, but it never gets dull. And, I'm getting towards the end of my career, which in some sense, I'm kind of happy because there's so much going on right now that it's hard to keep up with. And it gets a little frustrating at times, when you don't get paid for a service or something else, happens that prevents, claims from going out the door, whatever it may be. It gets very frustrating keeping up with everything and all the changes. But, it's been a great career for me as well.
And what's really exciting for me is being able to mentor other leaders and bring them up. I feel like some of the younger people that are on my team that are coming into leadership they're just full of really amazing ideas, and it gives me hope to navigate all of these challenges we're facing, because they're just really exceptional people.
Yeah. Excellent. Love it. Well, guys, you are rock stars. We really appreciate it. Those that will be viewing this in the future, lots of great nuggets here for them to take home and to kind of apply to what they're doing in their roles. We really love the knowledge share. That's what this is all about. So I can't thank you both enough for your time today. Stay cool as we get through our last I like to say that we keep 4 months of penance every year where it's like, this is gross. It's over 100. It's 90 at night. But then 8 months out of the year, not too shabby, right? I'm okay with the trade-off right now.
I will lick this over humidity any time because I grew up in the Midwest and I would not give. No, that is terrible.
I will take this over blizzards. Blizzards,
ice and blizzards. Nice.
Yes.
We had
I'll take the heat.
One of the best home bases ever because I lock my door and leave. My house won't earthquake, volcano, tsunami, blizzard, anything. It might be a little droopy because it melted a little bit, but outside of that, it's still the way I left it, Well, you guys, I will let you get back to your days. Thank you so much again. We really appreciate your time and your knowledge on all of these topics. And we'll just see what comes up next, and maybe we'll circle back in 6 months or so and do it again. Okay.
Thank you.
Thank you.